This is Scott Becker with the Becker Private Equity Podcast. This is a podcast that's really 12 legal issues aimed at hospitals and health systems, but so many of these legal issues also apply to private equity investment in healthcare that will also repurpose it for our private equity audience. And we'll talk a lot about, we've seen a tremendous increase in false claims actions, antitrust activities, including in the health system space, but also in the private equity space, ransomware and cyber attacks, and more. But again, here's 12 healthcare legal issues aimed at health systems, but a lot of this applies to private equity as well. Thank you for listening. The first thing we'll talk about is we're seeing at health systems, something I've not seen in several years, and throughout the healthcare industry, increased efforts by the Department of Justice and government interest in False Claims Act, Stark Act, and related issues. Record-setting amounts of settlements last year in 2023 related to managed care, hospitals, pharmacies, labs, long-term acute facilities, and more. So we're seeing that, more false claims actions and more Stark actions, more anti-kickback actions by the Department of Justice. Second, increased scrutiny from the antitrust prosecutors, the Department of Justice, again, the FTC, and the role of the FTC in looking at healthcare, more transactions that they're trying to block, more consolidations of health systems they're trying to stop, and we're seeing a lot of that as well. Third is you can't go through a day without recognizing that we're seeing a greatly increased number of cyber attacks and ransomware efforts. We ran a story at Becker's Healthcare on Scripps Healthcare hiring a former FBI officer or agent to help watch over some of this stuff. Also an article by Giles Bruce. Naomi Diaz wrote that first article about Scripps, but Giles Bruce talking about the targeting of healthcare by cyber gangs. Ransomware group leaders told hackers to attack hospitals, it's also payers, and so forth and so on. Fourth issue we're seeing more and more of, and again, you can't go through a day without hearing about this, is safety and violence issues aimed at employees, issues of systems trying to keep their employees safe, often from other employees or from patients. Fifth, continued work on pricing transparency issues and some of the CMS investigations there. Sixth issue, continue to see, particularly the last couple of years as payers were particularly strong, are these increased hostile negotiations between big health systems and big payers. Some of that is now spilled over into the Medicare Advantage programs, where some of the health systems are removing themselves from some of the efforts at Medicare Advantage undertaken by the big payers. Seventh issue, incredible amounts of negotiations and the efforts to unionize healthcare at every level, nurses, doctors, residents, and more. This is also a ripe activity given the shortage of healthcare workers, the shortage of healthcare professionals. The eighth issue that we're following from a legal issue perspective is artificial intelligence, concerns about the acceleration of artificial intelligence, confidentiality, negligence, how it will impact care, how it will impact a lot of things, and more. A ninth issue we're seeing a lot of, and we're also seeing this on the other side, but is business investment by healthcare systems in venture capital and other evolving technologies and innovation, trying to figure out if there's ways to capitalize on those for health systems. Naomi Diaz, again, wrote a recent article, 23 health systems with investment arms. 10th, continuing to see a good deal of acceleration of telehealth and digital health issues. It's not quite in everybody's mind like it was a couple of years ago, but still just now a part of the landscape and continued evolution there. 11th, Medicare Advantage, more and more lawsuits and government investigations related to Medicare Advantage. There's a great piece by NBC News about the new word of the day is deny, deny, deny. But as Medicare Advantage has become more than 50% of Medicare, more and more challenges between health systems and Medicare Advantage plans, and more challenges between Medicare Advantage plans and government believing that they're abusing the reimbursements there. Finally, 12th, we're seeing hospitals close units and some hospitals go bankrupt and how that impacts communities. Another issue I'll touch on really quickly, most as a postscript, is, and we've talked about this a lot on the Becker Private Equity Podcast, is the amount of state and federal regulation aimed at attacking or investigating or looking at private equity funds and their investments in healthcare. Again, this is a quick summary of 12 or 13 of the key legal issues affecting health systems. It's been some time since I've seen so much false claims in antitrust enforcement. Also, a number of these other issues, of course, cyber attacks and so forth. So many issues affecting hospitals and health systems. Right when we thought the amount of attacks and investigations and government efforts at regulating were slowing, it seems like they've accelerated again. Thank you for listening to this version of the podcast. Thank you very, very much.